Welcome back. We're continuing our in-depth look at joint function, this week focusing on the hips. So I'm starting here, articulating my hip from a standing position. And doing so from a standing position I find to be particularly challenging, but we should not avoid this because it's challenging. We should embrace the challenge and learn and grow from it. So I'm articulating my joint just like we've done before, in order to reestablish a healthy movement pattern and understand better the proper functioning of this joint, independent of the rest of my body. Getting good at this allows me to, throughout the day in daily life, subconsciously use my joints more effectively and harmoniously. So now I'm doing it from quadruped, neutral, stable spine, maintain the shape, pressurizing for stability, and from there I'm able to do the same. Bring my hip up into flexion, abduct away from midline, internally rotate, and extend to my fullest capacity without extending my spine. Back into neutral. Now I can pressurize again for stability. Extend fully. Exhaling, releasing tension to allow me to extend a little more so that I can then abduct away from midline, externally rotate, and come back up into full flexion. So lastly, I'm going to do it from side lying, just like I did in the original video. And this is a great position to learn to articulate our hips from, because like I mentioned in the previous video, we are more supported throughout our body in this position, so we're less likely to compensate. Also, our leg tends to feel a little bit lighter when we are more supported, so we can focus on our joint more easily and readily. So we're always doing them slowly and with control, not in any hurry, not trying to get anywhere, not trying to prove anything, just seeing what we're capable of, feeling how our joints are supposed to move, and learning, really setting in this experience in our minds of how to use our joints properly. So now we're going to work on improving our range of motion in a few different directions: flexion, extension, abduction, and then we'll go over rotation again. So this is important in a different way than the passive stretches that I've covered previously, where we are simply relaxing into deeper ranges of motion. Now we're having to use muscles to drive us further into flexion in this case. So we are releasing tension that's trying to restrict us, but we're also having to mentally drive our muscles further into the desired range. So I'm not compensating, I'm not changing my neutral stable spine shape, but I'm able to progressively access more range. And it is very taxing. Simply being at end range of motion is taxing, and trying to extend that range of motion actively is very taxing as well. So that's why we maintain a slow, steady rate of breath and reduce the strenuousness of this exercise as much as we can. So exhaling, releasing tension that's preventing me from extending further, and driving further into extension with my hamstrings. Now I'm not squeezing my glutes in order to drive my pelvis forward toward the floor, but my hamstrings are pulling my leg up further into extension. Just like when I'm trying to access further shoulder flexion, my biceps are flexing my shoulder upward into flexion. And so lastly, I will work on abduction here. That is away from midline of body, opposite of adduction. So I'm exhaling, releasing tension in my adductors to allow my abductors, my glute medius, to abduct my hip further away from the middle of my body, opening up my hips. Pressurizing, maintaining stability, then exhaling, releasing tension, and driving further into range of motion. So I would recommend spending more than just 3 breaths in these positions. The longer that we spend there, just like in a passive stretch, the more benefit we will gain from it. So now we're going to internally and externally rotate our hips. Very important joint functions. So I lift my knee a little bit over the lower leg, just for space to move. And then I'm internally rotating only at the hip. I'm not rotating my spine at all. I'm not changing my pelvic orientation at all. I'm internally rotating at the hip. And again, you'll likely feel this in your glute med and lateral hip region, driving your hip into more internal rotation, releasing whatever tension is preventing us from rotating further. And now I'm going to go into external rotation, and you will feel this in your adductors, inner thigh, near the groin. Driving further into external rotation, releasing tension that's preventing us from rotating further, not sacrificing stability. Spending time here, opening up space steadily, progressively. And those are the basic functions of our hips. Get familiar with them.